My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Alsobrooks. I'd like to thank you all for joining us as the County Executive brings some updates as to how we move forward in the midst of this pandemic. Followed by our County Executive, you'll hear from Dr. Ernest Carter, our Chief Health Officer, who will give us an update on our coronavirus case numbers and how we are addressing the situation. And finally, you'll hear from PGCPS CEO, Dr. Monica Goldson.
Good morning, everyone. I first want to thank you so much for joining us today as we offer really important updates regarding our efforts to fight the coronavirus, which has impacted our lives in absolutely unimaginable ways. I want to begin by thanking Dr. Ernest Carter, who is our Chief Health Officer. You will hear from him in a moment, but I do want to offer my sincere gratitude to him and the entire health department team who have just done a phenomenal job to help us navigate through this particular crisis. They have worked around the clock to continue to come up with solutions to help us to develop a path forward and to move our community back to reopen in a responsible way. I'm also pleased to be joined today by Dr. Monica Goldson, who likewise has done a phenomenal job through this crisis. Her leadership has been recognized not only here in our county, but I should tell you that I keep hearing about her on the state level as well. And she has led us not only as a professional and an executive, but also as a mother. She is the mother of a proud senior in our public school system this year, and so she's also led with the heart of a mother, and I want to thank her for that. This coronavirus has had on Prince George's County a very unique and distinct impact, one that we have not seen across the rest of the state. And given our geographic location as the major gateway to the Washington Capital Region, it requires us to take a strategic and tailored approach to make sure that we are protecting the lives and livelihood of Prince Georgians. We now have more than 8,800 confirmed cases of COVID-19 and 297 deaths. And I know that Dr. Carter will give you more information about that. But I am always reminded, and I remind each of you every time we say it, that again, 8,000 plus of our neighbors, friends, and family members, colleagues who are sick, and nearly 300, if not more by this point, who have died of COVID-19. And so we continue to offer our thoughts and prayers for those who are sick and suffering, and also offer our condolences to all of the families and friends who have lost loved ones. I want to be clear about one thing, and that is that this virus is not attacking Prince Georgians in our community because we have not paid attention to the warnings. This has not attacked our community because we have not taken this matter seriously. In fact, to the contrary, we have new information from the University of Maryland. It's mobility data that is collected. It's at the COVID-19 Impact Analysis Platform shows that Prince George's County is in the top 3% among all counties in the nation in terms of social distancing. And so I really want to thank our residents who have responded just beautifully in terms of adhering to the messages and the warnings that we have given them about social distancing, about covering up, about going inside, about limiting their activities. This data also shows that Prince George's County has the largest number of imported cases of actively infectious people traveling to our county since March 2nd. This means that this is more than any county in the state of Maryland. On the zip code level, it means that we have a good deal of people who come in and out of our county. We are located in a dense metropolitan area, and we have a good number of individuals who are essential workers who must go to work every day to risk their health and safety to ensure that we can still eat and that essential businesses can continue to operate despite the fact that these individuals have families and homes themselves. In the last several years, our community, as you know, has been on an unprecedented upward trajectory. We have been the economic backbone of the state of Maryland, and right now, Prince Georgians are hurting. While the rest of the state may continue to open, we must take measured and smart approaches to reopening non-essential businesses and resuming gatherings with families and friends and neighbors. And you know what? That's exactly what we're going to do. I have to tell you, I said it once already today, and I'll say it again. It is our duty to protect the lives and livelihood of Prince Georgians, and we take that very, very seriously. And we understand the need to get together. We do, but we're going to do so in a smart way and do so in a way that continues to protect lives. We absolutely need and we continue to request more tests and contact tracers from the state. And in fact, I had a conversation just yesterday with the governor. I want to thank him for his support and the support that the state of Maryland has given us. The governor assured me that they will do everything they can to make sure the tests reach us and that we will be prioritized. But as they say, God bless the child who has his own. And so I want you to know that as a leader of your county, we have been working to secure the resources that are necessary to make sure that we have what we need right now. Right now, we're testing about 5,000 people per week, and that is simply inadequate. Dr. Carter will tell you really that we need to be testing in the neighborhood of probably close to 15,000 individuals per week. To increase capacity, we have secured and continue to secure contracts with private labs to purchase tests. We're also working in collaboration with my colleague, County Executive Mark Elrick. Montgomery County and Prince George's County have come together to purchase additional tests. And we anticipate that in the next couple of weeks, we'll be able to open additional testing sites. We're looking to open those testing sites in the northern part of the county and in the southern part of the county. And it is our goal to increase our testing capacity to nearly 10,000 tests per week through our county testing sites and our hospital partners, but we will absolutely continue to need the assistance of the state. And again, I want to thank them so much for the support that they have given. We're also working to secure antibody tests that we hope to have in the next 10 to 14 days. Our health department has entered into contracts to secure additional contact tracers. As we continue to increase those numbers, we are also working to make sure we're maximizing efficiencies in the government. And so I have directed our Chief Administrative Officer to offer training to those inside our government who may be able to be trained as contact tracers, and we'll be hopefully able to expand the capacity of individuals who we have doing that work as well. We are also collaborating with other jurisdictions who are on the front end of this virus. Dr. Carter has stayed in touch, for example, with King County in Washington State. They are approximately 3 or 4 weeks ahead of us in this virus, and so we've been getting critical information from them as well. So we absolutely have a plan, and momentarily Dr. Carter will tell you more about what we need to see from a health perspective to be able to move forward and to open up our community. Prince Georgians, I know that this is difficult. Trust me, I know. I am accustomed to seeing my mother every day. I've seen her over the last several years. She comes to my home every single day, and I've not been able to see her. And she called me, and I'm sure that many of you are feeling the same this week, and said that she was feeling depressed about the time that we've missed together as a family. And, you know, I know these grandmothers, so I know quite honestly that she really misses my daughter. But I take it nonetheless that she misses me, I miss her, and we're all missing the contact that we have been able to have with our friends and family members. You want to meet up with them, you want to go see them, and I understand it. There are businesses, likewise, who would like to reopen. We understand the stress and strain that has been placed on our economy, and I want those businesses to reopen too. But the thing that we must do is to make sure that when we make those decisions, it will not cause our community to become more ill. That is what we're trying to avoid, is having this, to be able to open these businesses only to have to close them again. We're trying to avoid that. And so as the weather turns warm outside, I know that this will become even more difficult, but I still have to ask you to please practice social distancing. Please continue to wear those masks and limit your travel to essential travel only. I know that this is difficult, but I have to ask you to please trust me and just hang on a little while longer. We're going to move as quickly as we can to reopening. But again, we don't want to cause you to become more ill when we do that. So we do have to ask you, please, to continue to trust the word of our health officers, and they will give us the signal when it's safe to move further to reopen. With that in mind, after meeting virtually with leaders of our county hospitals, I've had a chance to meet with the leadership of each of the hospitals in our county. They alerted me that our emergency room visits are alarmingly low. And so I want to give you some information from the hospitals who tell us that they are concerned that those emergency rooms are very low. And the concern is that there are a good number of individuals who need to be in the emergency room or in the hospital for non-COVID related illnesses who are afraid to go to the hospital. And so I need to remind our residents that some trips are always essential. I know we've been saying not to travel unless it's essential, but there are some trips that are always essential. And if you need medical care, please don't stay home. Please get the medical care that you need. I'm hearing that those who are suffering from heart attacks, we're having people die from other illnesses because they are waiting too late to go to the emergency room. And so the professionals at our hospital systems and leadership have told us that they are taking every precaution to protect your life and to protect patients from disease transmission, especially COVID-19. So if you're experiencing a medical emergency, please don't let COVID-19 stop you from getting the critical care that you need. This week, I also want to talk about two programs that we are launching for Prince George's County residents. The first is a county-run quarantine facility, which will provide a place for residents to go to avoid transmitting this disease. The second program I want to talk to you about is rental assistance. Our new quarantine facility is located at a hotel in the county. We're still working on the final estimates as to how many residents will be able to serve, but initially our criteria for admission are as follows. Our residents must be tested at a health department location, and if that resident cannot isolate or quarantine at home, we will give them, a nurse will be able to examine that individual and make the decision about whether or not they need to go to our quarantine facility. If we determine that the resident can safely quarantine at home, we will simply provide CDC recommendations to help make at-home quarantine safe. Residents who live in a household with someone 65 years of age or older who have a chronic medical condition will be eligible for the county facility. And so we will provide admitted residents who are there with core services during their time of quarantine, including infection control materials, which will help prevent transmission of the disease, food, access to medications for other health conditions, social services, other needed medical evaluations, and transportation for medical care as needed. To gain access to this quarantine facility, again, you must be referred by a nurse. The nurse will ask residents their symptoms, and at the time that they conduct the COVID-19 test, and they can determine if that resident should be quarantined. We believe this facility, of course, is an excellent tool as we continue in our fight against the coronavirus. And again, I want to say thank you so much to Dr. Carter and our public health and public safety officials who are putting together so many of these kinds of programs to help our residents. Some of the admission criteria are subject to change as we figure out how much demand there will be, but we will continue to give you updates as we go along. To help also, one of the other tools that we've put in place to help our residents at this time is the Emergency Rental Assistance Program. I have heard so much from our residents regarding their concern about their ability to remain in their homes. And so we have put together a program that will provide temporary rent and utility payments for tenants who qualify. Each applicant will be eligible for up to $1,800 per month, depending on the need. The program provides a maximum of 3 months of rental assistance, and we believe that this will be helpful. We're going to help as many of our residents as we can. You all probably heard, as we did, that we now have 60,000 Prince Georgians who have filed for unemployment in our county. They have filed these claims since March 15th. So we know that this help is necessary and that it will be critical. We've developed eligibility criteria for this program, and it is based on median income, area median income, and risk of losing housing due to COVID-19. And this program will begin on May the 11th. To be eligible, applicants must demonstrate that they are at risk of losing their rental housing due to COVID-19 related financial crises and lack of financial resources, and support networks needed to remain in their existing home. They must also have a current income at or below 80% of area median income as defined by the Federal Department of Housing and Urban Development. Our county has committed just over $4 million in CARES Act funding to the rental assistance program, and residents should visit our website for more information. and to apply at mypgc.us/rent-help, or residents can simply call 211 or 301-864-7161 to begin the application process. And this process, again, will be open on Monday. We're encouraging our residents to apply online, but I must stress that whether you apply online or over the phone, we will not be accepting applications until this Monday, May 11th. So please don't call until that point, but May 11th we'll begin to accept those applications. The new quarantine facility and our rental assistance program are a direct response to the needs of our residents. We will continue throughout this crisis, as we have before, provide what is needed, whether it is food, whether it is housing, whether it is a quarantine facility. We just want you to know that we are constantly working to supply your needs. And before I introduce Dr. Carter, I just want to say a couple of things again to all the mothers out there. I want to wish you a very happy Mother's Day to the mothers, grandmothers, and mothering figures, to thank you for what you provide every day to so many in our communities, to our children. And so I want to wish a happy Mother's Day, and to ask you again, we just have to hold on just a little while longer. This will not last forever, and I have promised you that COVID-19 will not have the final say. We will certainly make it to the other side of this crisis, and when we do so, we're going to be stronger than ever. Stronger than ever. But right now, it is our duty to protect your life, to protect your livelihood, and we're going to continue to do that work as a community. So I want to say thank you to every Prince Georgian. You have just been so beautiful in terms of adhering to our advice. And speaking of advice, I want to introduce to you again Dr. Carter, and I want to thank Dr. Carter. I don't often get to tell you all that we have the absolute best chief medical officer in the state of Maryland. He is a Harvard-trained pediatrician who is eminently qualified, could be doing anything he wanted, but he has a heart for service, and he leads this county. He is our physician, and he is not only competent but compassionate, and we are so lucky to have you, Dr. Carter, and I want to thank you for being here today. So right now we'll hear an update from Dr. Carter. Thank you.
Thank you, Madam County Exec. Good morning. Our hospital systems are still experiencing a surge of COVID patients. It's been that way for a month now. Today we have 256 COVID positive patients in Prince George's County hospitals. It was 125 patients a month ago. Our ICU bed capacity is still a concern. 4 out of 5 hospitals in the county have utilized over 70% of their current ICU capacity in the last week. Under normal circumstances, our hospitals have 81 ICU beds combined. This week, an average of 112 ICU beds are being used in the county on a daily basis. For the acute care beds, the last 2 weeks have seen a 53% increase in COVID patients in acute care in our county hospitals. Multiple county agencies continue to work very closely with our hospitals, with us, to maintain the medical infrastructure we built up to tackle the challenge of this surge. As our case numbers continue to rise and as our hospitalizations continue to grow, so do the number of deaths from COVID. As the county exec mentioned, and as the governor has mentioned, well, as our county exec mentioned, and as I have mentioned, I'm sorry, the governor hadn't mentioned this, but an average of 9 Prince Georgians die every day from COVID-19. That's 1/5 of Maryland's COVID deaths. That's in our county. So our curve has not flattened, okay? I want to make that clear. Even during a flattening, COVID will still be among us, and we don't have a vaccine. So as the health officer, my top priority is keeping Prince Georgians safe and healthy. To ensure we can start to reopen and get back to business safely, we need to see a 14-day reduction in cases and hospitalizations per day, while increasing our testing. Prince George's County needs to move forward with caution. If we move too quickly, our numbers will start to rise again, and we'll have to scale back. I want to avoid that. As mentioned, a greater number of outdoor activities are now allowed in Prince George's. That's what the governor had announced the other day. And so those activities have started. Exercise is a great way to stay physically and emotionally healthy. But please be sure to take care of yourself and remember, we are still in the thick of the fight. Please continue to be at least 6 feet away from each other and wear a facial covering. Continue to clean your hands often. Keep your hands out of your face. You still have to wear a facial covering when you go to the store or you're on the public transit. The health department is offering free COVID-19 testing. Call us to get screened and make an appointment. The number is 301-883-6627. I want you all to be smart. I want you to stay safe, stay the course, and stay at home. Thank you so much. At this time, I'll hand it over to our superintendent, Monica Golden.
Good morning. I first want to thank our county executive who's done an amazing job providing a comprehensive plan to make sure that every resident is safe in Prince George's County, and I thank you for that. It's hard to believe that we are concluding week 8 of the stay-at-home order, and like many of you, I could not have imagined that after the 2-week closure in March that we would not enter our school doors again. Our students and our parents are missing the opportunity for that social interaction, but clearly understand the importance of their health and remaining at home during these difficult times. And although our school buildings are closed, we will continue our distance learning program, which are those lessons for grades pre-K to 5 that are on our public television station, our online learning that our teachers are doing through our Google Classroom for that student-teacher interaction, and the use of enrichment packets that are updated every week online and also provided at our distribution sites. Distance learning will continue until June 8th, and we will allow students an opportunity to make up any work missed during fourth quarter from June 9th through June 16th. We'll also continue to provide grab-and-go meals at now 49 schools until the last day of school. We have now added supper to the delivery of those meals as well. And the full list of those sites can be found on our pgcps.org webpage. We also know that there have been lots of questions and concerns about the closure of school and when parents and students can clean out their lockers and return valuable items like Chromebooks, textbooks, and other valuable items. And while those items are important, everyone's health is far more important. And so we're constrained by social distancing and restriction guidelines for mass gatherings. We will coordinate an opportunity for that to happen when it is safe to do so. But until then, everyone's health, safety, and well-being continue to remain a priority for us. On another note, the most frequent question that I receive lately relates to high school graduation. And high school graduation, as many of us can remember, is an extremely important time. For me, every day now seems like Groundhog's Day, and I am on Zoom overload. But I can remember that joyous time over 30 years ago when I walked across the stage in high school. And it is those kinds of memories that have kept me up many nights, thinking of ways that I could provide a meaningful opportunity to celebrate over 8,000 students in Prince George's County who will graduate this school year. So I am excited to announce today that Prince George's County Public Schools will hold a system-wide virtual graduation ceremony on Saturday, May 30th, in collaboration with ABC7. The celebration will broadcast the evening at 7 p.m. on WJLA 24/7 News and Charge. The event will rebroadcast the following day on ABC7. As I can personally attest, being a Prince George's County Public School alum is something extremely special. And I wanted a celebration that would feature other graduates who understand what it means to be Prince George's County Public School proud. So when I woke up one morning and said to the team, this is what I want to try to do, I was amazed and thankful by the number of famous graduates who stepped up and without hesitation, including our commencement speaker, said yes. On May 30th, we will welcome Oxon Hill High School's own class of 1988 Academy Award nominated actress, Taraji P. Henson, as our commencement speaker. The celebration will also feature Kenny Lattimore, Prince George's County Public School alum, Hall of Fame inductee, NFL cornerback Joe Hayden, Joe Claire, Taylor Thomas, and lots of other prominent alum. I know that there is nothing that can replace walking across the stage, and it is my goal and the Board of Education's not to do that. But I hope that our students feel our love and pride for all that they have accomplished, because I truly believe that they are the unstoppable class of 2020. Thank you.
So do we have any questions?
County Executive, so with regard to reopening, another press conference the other day, the numbers today continue the plateaus like downward statewide. It looks like next week there'll be some sort of an announcement, potentially. I don't want people to think it's a fact, but as the governor said, could be next week for a statewide reopening. Is Prince George's County phase one? Is Prince George's County ready?
Oh, we're ready. Yes, we are. This is what we will do. We're going to make decisions that are good for Prince Georgians. And so we're ready to make that decision. We have worked to make sure in the areas that I've discussed that we have hospital capacity. We're working to make sure we have the testing capacity that we do not have right now. I don't think anyone in the state right now has the testing capacity that they need. I'm in conversation 3 times a week with the county executives of the major counties in our state, and we all have the same struggles. We do not have the number of test kits that we need, although we're working to get there. We're working to make sure we have the number of contact tracers that are necessary to make sure that asymptomatic individuals are not walking around continuing to infect others. But in terms of whether or not we will be ready, we're doing the best we can to make sure that we are able to respond to those who have become ill. Again, as I said, God bless the child who has his own. So we have really taken measures to make sure we're able to secure personal protective equipment that is needed. We have contracts for that. But when you say, are we ready? We'll do what we can, but we're going to also make decisions that are specific and tailored to the challenges that we have met here in Prince George's, because we already know this virus has impacted us in a unique way. One thing I want to say, Dr. Carter told you that we now lose 9 people per day to COVID-19. 9 people die a day of COVID-19. This is a leading cause of death in Prince George's County, the leading cause of death. And so that is serious, and we're going to treat it that way.
Perhaps misphrased the question. Not are you ready to deal with it, but do you agree that perhaps next week Prince George's County would be ready to move to stage 1, lifting the stay-at-home order with the numbers that you have?
Well, you know what? I would let Dr. Carter and the health officer, I'll let him answer that, but I'm sure he'll tell you no. I'm sure he will tell you that we right now believe that we're at risk of having more people fall ill from this disease and virus. We are not quite there yet. I think that's what let him speak for himself.
Thank you, Madam County Exec, but she's absolutely correct. No, we won't be ready as long as we have increasing daily COVID positive cases. If they're increasing, then we're not flattening. We're flattening when every day is the same number of cases. That's flat. And then when they start to go down per day, and we get 14 days of that, of course you want 14 days of that, because when you were flat, you had a lot of folks who were COVID positive. After 14 days, they're no longer positive. And that's when reopening can really occur. It gives us natural immunity. It gives us herd immunity. It allows us to be confident, and especially if we have the testing. If we're testing and we've done it the right way, we will feel very confident that we kept our Prince Georgians safe.
So you
No, hospitalizations, that's the hospitalizations have to flatten. The ICU, we have to have the ICU capacity. What the governor said is correct for the state. But just like every state, if you look at California, you'll notice that LA has to be different than Northern California because there's different populations. Things happen differently. When you look at specific population density, what's going on. And we're unique, as the county executive said. So we're going to treat ourselves like we know we're supposed to. And the governor knows that. He relies on us to make those decisions. He relies on the county exec to make smart decisions. And so he's making the decisions for the state. We're making decisions that is consistent with what he would do if he were in our situation.
So is it possible that the state goes to stage 1?
We,
Georgia County says, no, we're still at stage
yes,
less than that,
yes,
with regard to stay-at-home order?
yes.
And so, you know, in fairness, we don't know yet what phase 1 is. The governor hasn't made clear what phase 1 will be. We don't even know whether the governor will decide that the state is ready for phase 1 next week. So we will, you know, analyze it as it comes. But again, I think the most important guideline for us is we're going to do what's best for Prince Georgians. And right now, we're still seeing escalating hospitalizations, escalating cases. We're nearing capacity in many of our ICU units. So those are factors that we have to continue to look at. But we cannot ignore, and it's so important for people to hear this, we cannot ignore the pain that people feel, the economic pain. There are lots of businesses that would like to be able to safely reopen. They would like to be able to use certain guidelines, social distancing guidelines and other things to be able to get back to work and get their businesses open, and we are not deaf to that. We care about it. We are trying to save lives, and we also care about people's livelihood. So we get that, but we'll analyze it as it comes and make a decision that is a responsible decision and one that is most concerned with saving lives and also helping people get back to some sense of normalcy. So we'll see what happens when that decision is made next week, and we'll make a determination at that point. I'll let Dr. Carter answer that.
We're still talking to the state about when we'll receive them. We are open to doing that. I know what the reception won't probably come to the health department. It'll probably go to our hospital systems. So I'll find out more about that.
And then I also wanted to ask about the test kits that the governor got from South Korea. I know that they were going specifically to hospitals and hotspots like nursing care facilities, long-term care. Has the county seen those shipments of those tests come in, plus the extra nasal swabs and the reagents that are needed for those tests?
I think that, okay, I'll let you.
So I have discussed this with the governor. We did request 90,000 of those test kits, and I was able to raise this issue again with the governor yesterday. And he assures me that they will work with us to try to provide some of those tests to our county. That the concern was that they needed swabs for them, that they needed reagents for those tests, and that they also wanted to make sure that we had the lab capacity to be able to analyze and get results from the test. So we have not, as of yet, received any of the allotment of tests, but the governor assured me that they would work with us to be able to have some of those tests come to us, and we'll look forward to it. Again, we want to expand capacity. We hope to open additional testing sites around the county in the northern and southern part, and to do that, we need those tests. And we're working to try to get contracts in place to purchase additional tests on our own, but we also are going to need the support that the state is going to provide, and they've assured us that they will do that.
Do you have an idea of a timeline? Did he say next week? Did he say a month?
we're going to be working with them right away to try to make sure that we have assurances regarding lab capacity and other things. So we're in constant conversation. We talk with the state all week long. So we're working on that as we speak. Dr. Carter, I don't know if you have any additional information about that or if I provided what you were.
No, only thing I'm going to add is that the state also works with us through laboratories to increase the number of tests. So we get our tests from LabCorp. We're working on contracting with another laboratory. And so we've gotten assurances that we will be able to test at the level that we would like. I don't have a timeline, but just like the county exec said, they're working very closely with us to make sure we get the number of tests we need. Oh, Dr. Golson. Okay.
Some of the questions I was asking is actually your answer. Thank you. If you're able to right now, with that announcement about the first graduation, you mentioned 8,000 high school young people, seniors. What will that look like? Will they be sitting at home with their names across the street?
Yes, it is virtual. We are working with WJLA to host a 2-hour what we're calling an e-graduation that will be held on May 30th. We will have a listing of all of our graduates' names as well as special appearances from famous alum who've graduated from Prince George's County Public Schools. And as stated earlier, of course, our commencement speech will come from Taraji P. Henson. Sure.
There's a summer school is still potentially happening this year,
So yes, we're in the preliminary stages of discussing with our Board of Education the options that we will provide for our students K-12 as it relates to summer school. So as we shared with our parents and community members earlier this week after the governor's announcement, we will be sharing that information prior to the close of school this year.
There's been a lawsuit again filed from the ACLU of Maryland asking you guys to, I guess, take away the fee you have to pay for required graduation courses. Is that something you guys are looking into or that you're going to be doing?
So it's important to know for that case to refer back to the Maryland State Department of Ed's decision as it relates to all local education agencies charging for summer school. What we're experiencing for this summer is totally different because we're coming off of COVID-19. So whatever decisions we make will not necessarily be in decision as it relates to ACLU, but more about the needs of our community, taking into account that we've been out of school for 8 weeks and we still have another about 4 more weeks to go before we conclude the school year. Thanks for that question.
So Dr. Golson has been very humble in her response to you. And one of the things I meant to mention, I'm really excited about this, is Dr. Golson and I have been in constant conversation about our concern about the achievement gap that we believe could grow as a result of COVID-19. So we've talked about many of the consequences and impacts of COVID-19, what the financial implications have been, what the health implications have been. But one other area that we are very keenly aware of is the achievement gap that could grow as a result of having our young people at home for weeks and weeks and have this interruption in their education. So we've talked about the ways that we're going to work together to make sure that we are addressing the needs of our students over the summer. We've discussed a virtual summer school that we hope we can make free to all of our students who need it. But we're also in conversation with private entities who we believe can provide to our kids the chemistry, the algebra, other subjects to enhance their learning over the summer, to make sure that we do not ignore the achievement gap that will surely grow if we do not extend to our kids the opportunity over the summer to study those subjects. And so we are very concerned about it. I want to thank Dr. Golson, who has been right there with us. We'll make further announcements next week. We're working, we have a COVID task force that we have set up. And that COVID task force, we will talk more about in detail. But one of the areas that we've discussed is educational recovery. We're going to talk about restoration and recovery, how we move past COVID-19 as a community. But one of the areas where we're bringing in experts and consultants to work with us is also around the idea of educational recovery and making sure, again, that as our kids go to sit in the future for SATs and as they sit for AP exams and other things, we want to make sure that our kids have not lost any ground as a result of COVID-19, and we are going to do everything we can over the summer to keep their education front of mind and make sure we're adding enhancements. And so I wanted to mention that in the vein of summer school. So it's not just for kids who need that, but our exceptional students who we want to make sure remain on a trajectory forward, that they are prepared for college and careers.
Final question.
Yeah, Ms. Gattison. County Executive Alsobrooks, or Dr. Wilson, I don't want to things. You kind of touched on it, but in terms of achieving gap and lack and separation of certain students with the blueprint of Maryland's future that the government did not approve of. What just the general thoughts on that leading to the future of education?
So we were very supportive on the blueprint for Maryland's future. We were looking forward, obviously, Prince George's County is one of the jurisdictions that would benefit greatly from it. We have a good number of students who are disadvantaged. Prince George's County educates the largest number of disabled students in the state. We also educate about 62% of our kids on free and reduced lunch. And so we do educate a large number of disadvantaged students and impoverished students and those who could really use the enhancements. So we're going to continue to work with the state legislature and continue to work with the state also to make sure that we are implementing the kinds of policies that help us to close the achievement gap. But one of the things we're talking about is what we just mentioned, is making sure over the summer, some of our kids have the advantage of being home with parents who are able to help them distance learn. And we know that some of our children, just because their parents are essential workers, do not have parents who are able to sit home with them during the day at the computer. So all of those gaps have to be, we have to be mindful of them, and we'll continue to make sure that we're doing everything we can.
Thank you.
Thank you.